Quick whistle-stop tour on COPD, why and how it happens.
COPD stands for chronic obstructive pulmonary disease. The COPD is basically a lung disease where the patient will find it very difficult to breathe. So you have a healthy airway here where the airflow is nice and easy for the air to get in and out. In a patient with COPD, in an unhealthy airway, you get limited airflow due to inflammation and mucus, making this airway a lot smaller and inflamed. Looking at a healthy airway, your air goes down the trachea and it'll go down into the lungs, all the way down into these little air sacs called alveoli. This is where your oxygen goes in, CO2 goes out, because your alveoli and the airway are nice and flexible. So your oxygen goes down this tube here, down into your lungs, into the alveoli, gets excreted into the blood for the rest of the body. In COPD, you get mucus, which causes inflammation in the airways. The airways become blocked and the O2 cannot escape, which can cause an increase in CO2. So here's where people can get a bit confused, because COPD is actually an umbrella term, and mainly these three causes are COPD. So you got your chronic bronchitis, your asthma and your emphysema. Patients can actually have both, and the most common two are bronchitis and emphysema. People with bronchitis usually appear cyanose, so you get the blue lips, blue fingers. Emphysema, you'll find they're very puffing. They're puffing out of breath because they're very, very short of breath. With asthma, people can get a bit confused because asthma attacks are actually reversible. It contributes to COPD, but the actual attacks of asthma are something that you treat separately. Whereas COPD is irreversible damage to the alveoli and bronchi because it's a progressive disease over a period of years. So when I say progressive, I mean it happens over a number of years. Smoking is the #1 cause, and you have long-term exposure to pollution, secondhand smoke and dust and irritants. That can cause COPD. And your influenza and your pneumonia are not causes of COPD, but it can cause an exacerbation. So you'll see patients come in with an exacerbation of COPD. It's very important to make sure that your patients with COPD have their vaccinations up to date. Symptoms at first, patients don't really have any symptoms because it's very early in the disease, but as it progresses, you can get shortness of breath, wheezing, chest tightness, which is worse upon movement, and a long-term cough, which is chronic. As the disease becomes more progressive, patients will struggle to cope with their day-to-day activities. They become fatigued, they'll get weight loss and muscle loss, and this can end in end-stage COPD. The test that we do for patients who have COPD or are going to be diagnosed with COPD is a spirometry test, which is similar to a peak flow, where you breathe into a machine, a chest x-ray, a blood gas, and you can do venous and arterial blood gases. You need to get an arterial blood gas. You'll do a blood test to see if they've got a genetic disorder, to see if they're AAT deficient, which is alpha-1 antitrypsin. It's a mouthful, but yeah, you'll get to know what that is later on in the course.
So there you go. That's not everything, but that's just a quick whistle-stop tour of COPD. So if you see a patient who's got COPD, it just gives you a bit of a better understanding of what's going on inside the body.